They never taught me this in veterinary school. I had to learn it over time. Never doubt a pet owner's intuition. No one knows his or her pet better than the person who sees this cat or dog day in and day out. It's of paramount importance for this primary caregiver not to overlook changes they see at home. Subtle can be significant. One of the best ways to ensure that your pet lives a long, quality-filled life is to schedule twice yearly wellness examinations. When a problem is found early, it's typically easier to treat, costs less to do so, and the outcome is usually better. Since one of our years is about 7 pet years, during the time between veterinary visits, a great deal can occur. This is where you and your intuition comes into play. Keep a pet health journal. Keep track of changes. Is your pet eating more or less? Has there been a recent change of diet? Is someone new feeding your pet? Has a new pet come into the home? All of these factors can affect a pet's appetite. Has your pet altered his water intake? It may be warmer weather that's caused an increased thirst or a new water fountain that's tempting your pet to drink more. An increased thirst can be a sign of a urinary tract infection, diabetes mellitus, liver disorders, kidney disease, plus a host of other conditions. Noticing any changes in bowel patterns? Constipation can be as serious as diarrhea. New foods or treats must always be a consideration when you see a variation in stool form, odor, or frequency. What are the urinary habits? Urinary accidents in the home may signify that the pet has a bladder infection or attest to the fact that the pet has never been fully house-trained. Straining to urinate, passing no urine, or seeing blood in the urine are all indications your pet should be attended to by your veterinarian immediately. Has your pet's weight gone either up or down? Weight fluctuations due to dieting or overindulgence are not unusual, but gaining or losing when there has not been variation in food portions is an indication for a visit to your pet's doctor. Is getting up or down or jumping onto the bed becoming difficult? Osteoarthritis affects 1 in 5 adult dogs. There's no cure, but there is medical care that can decrease the pain associated with this progressive degenerative disease and improve the quality of your pet's life. Is your pet's coat less shiny? Have you seen dandruff? Is your pet itching, biting, and scratching at itself? Dogs and cats can have skin issues for every reason that you and I do, and then some. Can you smell your pet before it enters the room? Bad body odor can emanate from infected ears, oral disease, skin conditions, or leaking anal glands. Sometimes a pet just needs a good romp in the tub. If your cat or dog typically bounces off the walls and now it's content to sleep all day, it may have just grown up, or it may be ill. Changes of behavior and demeanor should not be overlooked. Finding that your pet refuses to chew on its favorite toy or is hesitant to eat a treat may signal dental disease. When was the last time you had your pet's teeth cleaned? Bad teeth can be a source of pain and infection for the entire body. Flip the lip and take a look and a sniff. The teeth should be white and the gums pink. The border of the gums and the teeth should be tight and not red and swollen. If your pet's breath is foul enough to knock you over, that's not normal. See your veterinarian for a dental cleaning. At times, you just can't put your paw on it, but you know that something's just not right. If your pet is not in obvious distress, is eating and eliminating normally, you may opt to merely observe it for a day or two. If the signs persist or worsen, do not ignore them. Make an appointment to see your veterinarian and bring your journal with you. Your pet's well-being depends on you and your veterinarian working together as a team. Have questions about your pet's health? Just ask your veterinarian.